A lot of teams still live, whether it's in spreadsheet or action only EHR workflows. What is the biggest difference when you add a CRM as an engagement layer?
It's really making the data actionable to provide the personalized level of care. So spreadsheets are great if you're just looking to track information. I know spreadsheets and Excel can create some pretty cool reports or pivot tables, but what Excel and spreadsheets can't do is it can't actually automate tasks to your care team or your intake team or a practitioner to follow up based on a condition or follow up based on a missed appointment. It can't send educational, emails or SMS around a certain type of condition or appointment reminders and things like that. And so when it comes to improving patient experience, unified data is really the first half of that. And yes, you can try to unify all your data in something like a spreadsheet or even an EHR, but you really need that second layer to facilitate communication and make that data actionable when you're personalizing your communication and quality of care with the patient. So I think that's really the biggest difference is that kind of actionable data engagement layer that the CRM offers. I would also say to cross-team collaboration. So, depending on your healthcare organization, you might have an intake team or a care team, administrators, practitioners. You might get referrals from specialty practices. And so there's all these different teams that might be working out of different systems or spreadsheets. And the value of the CRM is because you have all that data unified in one place, it really fosters that cross-functional team collaboration where maybe a caretake member can tag, a practitioner or an administrator and say, hey, they missed their appointment. Can you give them a call? Or we should follow up in 6 months without having to necessarily like pick up the phone or write it on a sticky note.
And Jordan, you've supported a lot of the healthcare rollouts at HubSpot. Like, how do you guide a team from thinking of CRM as a care infrastructure?
In the healthcare space, you can almost re-anchor the C in CRM to like from customer to care. It starts with these use cases. Instead of tracking deals, you're tracking these patient journeys that we've talked about. Instead of forecasting revenue, you're trying to forecast your care demand and how to staff for it. And then once these teams like see the platform really as this infrastructure that supports end-to-end scheduling, education, follow-ups, retention, it really becomes much more natural to operate in this kind of patient-centric mindset and kind of groundswell the effect of organizations trying to roll out a CRM platform.